Hello, everyone, and welcome back to the Beat Podcast. We're recording live here from Health in Las Vegas. I have the privilege of hosting Beth McCombs today. Beth is the Executive Vice President and Chief Technology Officer at Becton Dickinson. Beth, it's such a pleasure to have you here with us.
Great to be with you too, Saul.
So how's the meeting going for you so far?
Well, it's been a great meeting, just seeing the diversity of different companies that are serving from a consumer wellness perspective all the way to highly acute hospital environments, and then hearing from customers how AI and connected solutions are improving patient care. It's been really inspiring and just fun to be out and about with the group.
I'm glad to hear that you're sort of getting all angles of technology here. And so tell us a little bit more about your role and what you do at BD.
Sure. So as you said, I'm the Chief Technology Officer for BD. So I'm responsible for research and development end to end. So everything from front-end innovation all the way through taking care of the products in the field and making sure that they're always of the highest quality and reliability for our customers. So I work for BD, which is a top 10 medtech company. We have a very diverse portfolio from our connected care solutions that I'm sure we'll talk a fair amount about today, to our medical essentials, which are really what we think about as the backbone of healthcare. We sell 34 billion products every year, and those medical essentials like specimen collection tubes are used to collect samples for patients 84 times every second. So really high scale there. We also have interventional products, implantables, as well as solutions for biopharma and life sciences. So very diverse portfolio. I feel like I'm a kid in a candy store as an engineer and scientist to be able to have all these capabilities to solve important needs in healthcare.
Well, it is definitely the place to be. A lot of innovation, a very well-known brand, and I'm excited to be chatting with you today. So tell us a little bit more about how BD is reimagining care delivery to improve both access and outcomes, especially for historically underserved populations.
Yeah, it's so important. And as I mentioned, with BD's footprint globally, with 34 billion products, we serve patients in 190 countries around the world. And any patient that enters a US hospital, 9 out of 10 times will be touched by a BD product. So we take access very seriously. And of course, ensuring that we have the highest quality, lowest cost products to provide to our customers so that they can serve patients as well as possible. At the same time, as we think about the future and where healthcare is today, we know there's tremendous financial constraints on hospital systems. And so we see so much opportunity especially in the connected care area, but really across our entire portfolio, to focus on productivity and economic value in addition to the clinical value of our portfolio. And so really looking at how we can take waste out of healthcare, how we can drive the right intervention for the right patient at the right time. That's really where we see the opportunity then to provide more resources for our customers to be able to serve patients versus having to kind of spend time wasted on manual operations or getting the wrong medication to a patient. So one of the areas we're very focused on is in the connected medication management space. And we have solutions that go all the way from the central pharmacy to the hospital pharmacy to the hospital floor and then to the patient bedside. And so if we can really track those medications through that entire system, and today we have tools that really enable inventory management to reduce potential stockouts or to prevent medication errors like alert allergies, et cetera. So if we can provide some of those productivity solutions, then you have less waste, you have less expired medications, and then that frees up resources again to take care of patients.
Yeah, that's a really great example of just being able to follow the entire journey by using technology, taking waste out in a time where taking waste out couldn't be more important.
Right.
With so many emerging technologies that you have at your fingertips, Beth, how do you decide which innovations to invest in, and how do you measure their real world impact?
Sure. First of all, as an engineer, we like to solve problems, and it's very important to spend time with customers and really understand, are you solving a problem that matters, or is it something that just seems interesting and that you could come up with a prototype to address? And so really being deeply engaged in knowing our customers, and not just the executive level customers, but kind of getting down on the floor and really watching the workflows and what's happening is so important. Once we understand that, then we can really find the viable solution and understand if it's something that we can scale as BD. So do we have either the technology capabilities, the commercial footprint, the business model to be able to scale that and impact more patients? And so that's really the way we think about where we invest both organically in R&D as well as when we think about acquisition. And as you mentioned, evidence is so important. We think about that very much upfront. What is the differential value of this innovation? And how do we prove that over time? And certainly we will do clinical studies to demonstrate the value. One of the things I'm really excited about is how BD partners with our customers as well to develop real world evidence. And one area that we've worked with our customers to really develop real world evidence to demonstrate the value of our products is with our vascular access management portfolio. And so this is our peripheral catheters that are typically one of the first devices that a patient would interact with during a hospital stay. And we've partnered with one institution, Scripps Health, and this is a published study, to look at the impact of our product portfolio as well as some of the training that we were able to implement to drive better outcomes in vascular access management. And what we found was the ability to reduce cost by about a third. And we were able to reduce the blood exposure for a healthcare provider by 61% and also increase the dwell time of the catheter by 79%. So just some examples from a safety perspective and from a cost perspective, how both the combination of training and the right product portfolio was able to better serve patients.
Well, Beth, first of all, you have a brilliant mind
Oh.
because all those numbers that you know, do you have a photographic memory?
I wouldn't say I have a photographic memory, but I do. I'm pretty good with numbers.
You're
I
pretty
will
good
say
with
that.
numbers. I can see that. And so with the catheter, what was the mechanism that allowed for this improvement?
Yeah, it was really understanding what product to use when, and then having common standard practices in terms of the management. So once you place the catheter, how you take care of that over time with the patient, getting the first stick success, et cetera. So nurse clinicians who come in and will really work with the hospital on those best practices, and then at the same time recommending the right portfolio to reduce potential complications and minimize cost.
Got it. So not only the product, but when that product's used and the process around and the training.
Exactly.
Of the product,
Yes.
The entire process. Well,
I think
very
it's
cool.
a huge responsibility in medtech that we need to,
Totally.
the product and the training have to go hand in hand to deliver the right care.
I totally agree.
Yeah.
Well said, Beth. And so when you take a look over the next 3 to 5 years, right, you're in a position where you're making long-term strategic decisions. What bold bet is BD making that you believe will truly transform the healthcare experience?
Right. We see three main forces in healthcare that every time I talk to a customer seem to ring very true. And a lot of times they'll say it in different ways to me, but it really fits into these three areas.
Sure.
The first is the opportunity to capitalize on connected care, AI, data, robotics. Of course, that's what this conference is all about. And the example that I'm sure we'll speak about soon of our BD Incada platform, our new cloud-based connectivity and data platform, is just one example of how we're going to really integrate the entire ecosystem of BD products to simplify for our customers and to enable that next generation of AI. The second area we're focused on is new care settings and how we can meet patients where they want to be in lower acuity settings, sometimes even in the home. And one example we have of that is our PureWick device. So this is an external urine management catheter. So it's been used in the hospital. Nurses love it. It's much easier to work with patients. And we've moved that into a home care setting as well, and just recently launched a version that's portable. So a patient that's suffering from urinary incontinence does not have to then be homebound. They can go out and about and have confidence to be able to go about their daily lives. So getting into those new care settings is important. And then finally, chronic disease outcomes. And we have a portfolio of device solutions to both treat and help maintain and deal with chronic disease. One area we're really passionate about is peripheral vascular disease. Still a lot of unmet need in venous disease as well as below the knee arterial disease. And so we're investing in a broad portfolio of organic and inorganic innovation to provide better solutions where there's high morbidity, high mortality, and opportunity to intervene earlier to make a difference for those patients.
Well, I really love that, Beth. And this theme of a patient's not their condition, and the fact that you're also a dad or a mom or a son, and how you live your life, where you want to live it. It sounds like you guys are being very thoughtful in meeting patients where they are.
Absolutely. I mean, I even have my own personal experience with my mother who needed an infusion, and she had to be in the hospital to get the infusion, and she really didn't want to stay overnight in that hospital. And there was no reason that couldn't be accessible to her. So finding ways that we can do that both from the technology as well as the policy and payment side is really important.
Totally. Super impactful. So let's have some fun with this discussion. Very exciting. BD Incada. You guys announced it this week at Health. Can you tell us more about it, and what is it? Why is it significant?
Sure. So BD Incada is our cloud native AI-enabled platform to really be the foundation for all of the connected BD products in the portfolio and to provide interoperability as well as a data platform to be able to converge all of our BD data as well as data from other sources to drive better outcomes. And so this is a journey we started on a couple of years ago. We have about 3 million right now connected products that are in the market today,
Cool.
generally on-prem technology stack. And so this is our opportunity to really shift to the cloud and get all of the advantages that come along with that. We're also launching as our first anchor product with BD Incada, the Pyxis Pro. So this is our automated dispensing machine that will provide a new hardware solution. It actually has more flexibility and higher storage capacity that our customers can get more medications on the floor, which is important so that the nurses and patients can get their medication more quickly. And so we're powering the Pyxis Pro with Incada and also providing a new analytics package that uses natural language processing as a way for our customers to interact and to really use dynamic dashboards to understand any question that they have about the medication within the hospital, where there might be issues, where there might be shortages or stock out issues, that we can help highlight those things proactively. And then they can get better both clinical and financial outcomes.
Well, I think that's fascinating. And just to clarify, 3 million products, mostly on-prem. This BD Incada is really opening up the opportunity to do a cloud-based solution, right? So they're no longer tethered to on-prem solutions.
Right. And we do have some cloud-based analytics solutions that are already available, but this is going to help us take it to the next level in terms of the actual operating system and connectivity of the hardware, so we can just do things that we weren't able to do before.
Super exciting. And with so many products, you must have a great team.
We do. I am privileged to work with just an amazing team that is so technically capable and fun to work with, and also passionate about healthcare. And I think that's what a lot of people say. You come to healthcare industry and you never leave, because it's just such a special privilege to be able to try to make healthcare better for patients and restore health.
Totally agree. Yeah. So a big shout out to Beth's team.
Yeah, absolutely.
All right. So what's your vision for BD Incada? Not just in terms of supporting better patient care, but also in how it helps unify data across the healthcare ecosystem.
Yeah, it's a big theme here at the conference is, enterprise interoperability, and all of us can experience how we have different pieces of our health data in different locations. So this is really BD getting our house in order and having one platform, first of all, that is easier to implement for our customers. So we know every time you try to do an implementation, or if we're trying to do a data study with a clinical customer, the IT department is really the constraint. So this is a scalable platform where when you start with Incada, we have this backbone, and then we can be plugging in new anchor products to that, so it's easier for our customers to implement. Secondly, by being able to see across your entire health system, all of your data in one place, it really changes the paradigm where today you may have a customer that has to go run a report manually at every site and then kind of put that all together in one big Excel spreadsheet and try to figure out what's going on. Now this is all integrated and at your fingertips, the ability to drill down into specific locations and also look at a macro level on what's happening within your system. So really excited about the potential for that in terms of medication management and so many other use cases across our portfolio. And then finally, as we know, in order to go fast with AI, you have to have your data right. And so getting our data structure right and making sure that it can all come together, of course, with the right data governance and customer contracts to ensure that we're managing all of this responsibly to really improve the capabilities of our solutions going forward.
That's fantastic. Very exciting. And all the use cases just keep popping up in my head, like from biomed, understanding where everything is, to what's available, inventory management, like outcomes improvement. Take your pick, right? Just connecting it first and then making it happen. How do you see AI supporting your portfolio with these new solutions?
Well, I had mentioned natural language processing is a place that we've started, so it really enables the power of AI with a very natural, kind of easy way of interacting with the system. So that's certainly the place that we're starting. We're also using dynamic dashboards as interface to be able to take advantage of that capability. Certain machine learning and really building bespoke solutions is also a part of our portfolio. So with our new family member in BD, our advanced patient monitoring acquisition that we made last year, there's really advanced capabilities in machine learning that we're using to, in one case, we have an algorithm that can predict potential hypotension for a patient who's getting cardiac surgery. And of course, low blood pressure can lead to other complications, and a very compelling technology. And similar to what I mentioned before on vascular access management, we're partnering with multiple healthcare systems to look at the value of that in terms of reducing complications like acute kidney injury, as well as how we can reduce length of stay and overall cost and patient experience. So those are, just a couple areas, but a lot of exciting potential of how we pull this together. And I really think this is going to be the next wave of innovation in medtech and how we differentiate with software and AI to make more personalized, more integrated, and streamlined for patients and for the customers that are taking care of them.
Yeah, no, there's some great examples there, Beth. Really appreciate you sharing those with us, and certainly exciting times for folks that want to reach out and learn more, or maybe a customer that uses BD products that wants to maybe take the next step. Like, what's the best place for them to reach out and learn more?
Well, you can certainly reach out to me. I'm sure the contact information will be, on the podcast. If there's a new technology, and we have an amazing commercial organization that's serving our customers worldwide. So we can definitely point that customer in the right direction to have the right support in terms of what they're looking for and how we can help meet their needs.
That's fantastic.
Yeah.
Well, we certainly appreciate that. And folks, check out the show notes. All the info on today's podcast will be there. BD's website. And so take advantage of taking a look at that. That's where all the resources will be. Beth McCombs with us today, Executive Vice President and Chief Technology Officer at Becton Dickinson with us. Just an incredible opportunity to chat with her. Beth, thanks for joining us.
Thank you, Saul. It was really a pleasure.